I'm Dr. Nandita Mohan and I welcome you to Medical Dialogues, your daily dose of health and medical news. Here is what we have for you today. Ketone Supplement, a novel therapeutic for boosting the brain function in obesity individuals. People with obesity are known to be at a higher risk of developing cognitive impairment and neurodegenerative diseases. A new study has found that giving a ketone supplement 3 times a day for 14 days enhances the blood flow to the brain and improves the aspects of cognitive function like working memory and processing speed in adults with obesity. The authors quoted that once validated with a higher group of people, these supplements can be used to protect and improve brain health in people with obesity. Smart glasses improve the success of radial artery catheterization in small children. Hand-eye coordination and ergonomics are 2 important success-defining factors, especially in medical procedures. These can be improved using smart glasses by decreasing the head movement, especially when working on the ultrasound screen. In pediatric patients with small body sizes, there is a limited space allowed for the anesthetic procedure, and the position and posture of the operator must be adjusted accordingly. A study that was recently published in the Anesthesiology Journal supported this hypothesis. It stated that smart glasses during radial artery cannulation improve the first attempt success rate as well as the ergonomic satisfaction. They also help in lowering the procedure time, the number of attempts, and also help tackle procedure-related complications in pediatric patients aged less than 2 years. High salt diet may disrupt the body clock and increase risk of diseases and death, reveals a new study. High salt intake is known to increase the risk of developing high blood pressure and heart diseases. However, the intensity of this damage is confirmed by a recent study presented virtually at the 17th International Conference on Endothelin. The study reported that salt may disrupt the body's internal rhythms directly, thereby increasing the risk of metabolic syndrome, inflammation, mood disorders, cancer, and even premature death. With an estimated 90% of the population over 2 years old consuming too much of salt, these new findings could have widespread implications. Hence, the intake of salt needs to be measured to increase the life expectancy. Transient Pericarditis reported in adolescents following COVID vaccination. Vaccines are paramount in the effort to end this coronavirus disease. However, there are certain complications that are documented even after vaccinations. One such report in the Pediatric Infectious Disease Journal stated that adolescents presented with perimyocarditis following Pfizer vaccination. All patients were males and 16 to 18 years of age who presented with chest pain beginning 1 to 3 days following vaccination. Notable abnormal findings in these cases included elevated troponin levels, ECG changes consistent with pericarditis or myocarditis, and abnormal findings in ECG, predominantly pericardial effusion. It was then concluded that all cases were mild and none required hemodynamic or respiratory support, although only long-term follow-up is mandatory to reveal the true impact of this cardiac injury. Monitor troponins for up to 3 days after non-cardiac surgery, says American Heart Association scientific statement. Myocardial injury after non-cardiac surgery is up to 3 times more likely in patients undergoing emergency surgery. 90% patients with myocardial injury after a non-cardiac surgery have no identifiable symptoms but are at 4 times higher risk of death at 30 days. Previous studies have documented that about 20% of adults who have major non-cardiac surgery have elevated troponin levels. High concentrations of troponin in the blood indicate higher damage consistency with a heart attack as seen in myocardial injury after a cardiac surgery referred to as MINS. But the American Heart Association has released a new statement that although majority of the adults have elevated troponin levels after heart surgeries, yet nearly all of them did not have symptoms of injury. The condition usually emerges within 2 days. Therefore, serial troponin testing is advised for the first 48 to 72 hours in patients at moderate to high risk. MINS is serious despite the lack of usual cardiac symptoms mentioned, the chair of the scientific statement group. It is more likely to occur in people with pre-existing cardiovascular risk factors, including older age, males, those who have high blood pressure, type 2 diabetes, congestive heart failure, anemia, and obstructive sleep apnea. Several large prospective observational studies have provided strong evidence that high troponin levels after surgery is associated with higher rates of short and long-term death and major vascular complications. The statement proved to be a major step in the field of myocardial injury and hopefully the first step to promote the broad use of troponin screening in people at risk of cardiovascular complications. Increased screening can help to improve patient care and reduce the cardiac complications and mortality of patients undergoing surgery. However, additional investigation is necessary to determine specific mechanisms of MINS so that targeted therapies can be developed. Efforts to improve recognition and understanding of MINS will ultimately improve outcomes for people after non-cardiac surgery. That's all we have for you today. Let's meet tomorrow.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.